guys, welcome to another episode of Bant and Rant. I'm your host. I am Tichwa. And as you can see, my guest and I are wearing different shades of pink. So you should know we are in October and then it's Breast Cancer Awareness Month. So that's what we are bringing to you guys today. But before that, I will let them introduce themselves. On my left, we have...
Hi, I'm Enyonam Hosi.
Hello, Enyonam. Nice to have you here.
Nice to be here.
I like your outfit.
Thank you. It's my new collection.
Oh, okay.
Period.
And then we have our very own doctor.
Dr. Gregory, clinical oncology pharmacist.
Okay, doctor, you're welcome. So he's come to answer all our questions that we may have about breast cancer, and then also educate us. And then we have our very own
Ginger.
Hi, Ginger.
Hi.
Okay, so before we begin, doctor, what is breast cancer?
Okay, so when you talk about cancer, mostly we find difficult in understanding the terms. So I think you have to start with cancer, then we go into breast cancer. Right. So with cancer, it means the cells in the body are dividing unevenly, or they are dividing at a pace that's not normal. So then you say, okay, we have an overgrowth, or we have a cancerous cell that is being produced. So when it comes to breast cancer, it means cells in the breast are dividing at a rate which are beyond the normal. So when that happens, then we say that, okay, this person is having breast cancer. That's in the layman's term.
Oh, okay. Yeah. All right. So with breast cancer, right, how does one detect, like, that maybe I have breast cancer? Or like how will one know that I'm getting breast cancer or I've gotten breast cancer or something? Because I'm sure it doesn't come with like some peculiar symptoms.
So when it comes to breast cancer, it can be with you for years, depending on your immunity as a human being and other risk factors that can predispose you to it. So there are women who we've seen at the hospital who never knew they had breast cancer until they came to the hospital. Then we ran tests. That's when they got to know that they are even having breast cancer. So at the beginning or at the early stages, it's painless. You might find painless, though you won't have any symptom. Until it gets to the advanced stages, that's when you begin to have symptoms. Then, even with that, sometimes it's not pointing to your breast. You might have symptoms elsewhere in your body.
Oh, really? I never knew that.
Yeah.
Like where? Where else in your body?
So, with breast cancer, it can spread to any part of your body.
Oh.
That's if it gets to the stage 4. It can go into your brain, your kidney, your liver, your bones. That's how serious it can be.
Oh, yeah. So at which point did they cut off the breast?
So when it comes to the cutting, that's the mastectomy. That's the procedure. So that's what we do. When you come to the hospital and you are screened, we know that, okay, you have a lump in your breast. When you have a lump in your breast, it doesn't mean that you have breast cancer.
Yeah.
So we always tell women, have self-examination of your breast.
Yeah.
If you see something unusual in your breast, report. Sometimes you have lumps in your breast. Sometimes it will be in your lymph nodes.
Yeah.
So the breast extends to the armpit area. So sometimes some people, the lump will be in the breast area. And it doesn't mean that you have breast cancer. So the lump can be non-cancerous or it can be cancerous.
Okay.
So whatever the case, we have to do the screening. We have to do CT scans.
Yeah.
Sometimes we do other scans. Then we will do biopsy. So the biopsy, you will pick tissues from the lumps and run it at the lab to see if it's cancerous or not. That's when we say, okay, now this person is on this stage of cancer. This person is stage 2, stage 1, stage 3. Now, when it comes to the mastectomy, either we will do total mastectomy, that's we take off the whole breast, or we will take off the lump. So you might have found a lump in your breast. We will do the lumpectomy. So you will take off the lump out of your breast. Okay. Then we will go and test the lump to see whether it's cancerous or not. So if it's cancerous, you are safe. At least you've taken off the lump.
But can it grow back?
Oh, yeah. I know people who have
Really?
taken like
Yeah, cancers actually do come
because
back.
I
I've
heard that it can grow back. That's what I was asking.
You know, I've had a breast cancer scare before. Where I used to,
Really?
where I used to work, we had like a nurse come. It was in October. We had a nurse come and do like all this, like screening for the women. And then the lump was found. I had to do the CT scan and everything. And then they found out it wasn't cancerous. But because of that, I have to check very often and make sure that everything is
Did
fine.
you check last year?
No.
Why? Because you were at TLH last year. So why
I
did you
didn't.
check?
I mean, it's true.
Yeah,
No,
'cause
I
you were
did.
doing
I did. I
free
did. I
screening.
actually did. I did. The woman checked us. Oh, I did. I just realized I was
If
such a
you say
event.
so.
Okay.
Oh,
if you
no.
say so.
And then I'm coming to that. I know you own a brand,
Yes.
Greg, and then like every year you guys do an event for breast
For
cancer
breast cancer,
awareness.
yes.
Can you tell us a little bit about that?
Okay, so it didn't start off as an event. It was my brand colors are pink. So every October I used to do a pink October sale. And then last year I decided to do a pop-up sale. But because it was October, I figured, if we're just bringing people together, instead of just coming to buy stuff and leave, we can just do something that would help. So we got doctors on board. We did free screening that Ginger didn't take part
I
in.
did though.
We did free screening. We had a little health talk.
Okay.
Yeah, but then this year we're doing it a little bit bigger. So we have a breast cancer survivor that we're working with.
Oh, okay.
She has actually had the surgery. So she has just one boob and she's quite young. She's 24.
Oh.
Yes, which I feel like a lot of people don't know that young people
Can
can get
get-
breast cancer. Even I
Yeah.
didn't know. I feel so when we're looking for somebody, I went to Kwadwo. I spoke to maybe like 10 ladies. Everybody was like, oh, they don't want anybody to know they've had cancer. But then what I realized that most of these ladies were younger. I thought I was going to speak to older women. So when I was going, I had prepared my questions in a way, but most of them were younger. I think like 4 of the ladies that agreed to work with me were below 30.
Wow.
Yes. So we unfortunately had to deal with just one lady. That's the lady we're working with this year. She's 24. She has a kid. Yes. So we are doing a fundraising for her this year. We're raising funds. So we have a GoFundMe. I'll share the link so you guys can donate.
Period.
So we're doing a GoFundMe to raise some funds for her she has had the surgery already. So just to pick up her pieces and start life again. And then we'll be doing a free screening as well, health talk again, and then sales.
Okay.
When will this?
It'll be on the 26th of October. That's the last Saturday. And we'll be doing it at Marina Mall this year.
Oh, okay.
So
All right.
please come and help us raise funds for our survivor. Check your boobs, both men and women, because
Yeah, because men
I
do
wanted to
get
come and ask,
yeah,
I
men
wanted
do
to
get
ask.
breast
But I
cancer.
mean,
as well.
everybody
question.
talks about women's boobs,
Yeah.
so it's mostly like women.
Mhm.
But then the men can come. You can, if you want to help us check the boobs. Say,
Eh,
we'll
Scanty
give
will
you
be
guys. We'll give you guys. Just give you some outfits to wear. You can
Okay.
help us do the checks.
Okay. Yeah. So, doctor, but what she said, men do get breast cancer too, right?
Yeah, so men get breast cancer, but the majority of the cases
It's
are women. So if you
okay.
take, let's say, 100 men, you can have like 2 that's
Men.
having breast cancer.
And it's possible because
Yeah.
the men out there think that the breast cancer is only limited
Yeah.
to women. Yes, I was telling Scanty that men can get breast cancer, and he was surprised. He was arguing with me, but men can actually get breast cancer. So with the screening that will be done like in October, I know different people will be doing screening and things. Like men should also go get screening, right?
Yeah, my
Now,
guys.
how do you check for men?
Yeah,
because
because for women, there's a lot of
something to how do we check for
It's
men?
the same for men.
the same
But
procedure.
how do you feel the lump if the person is
I think it will be more
muscular
prominent if
and-
it's a man. Because ideally, do men have like nodes in their chest?
I don't think so.
The size of the notes is not like that of
It's not as
women.
prominent
okay.
as okay.
Right.
But then, is there a stigma for like, because you were saying the women don't want anybody to
Yeah,
know
they
they
don't
have
want
cancer?
anybody
Is
to
there a
know they
stigma
have
for like
cancer.
people who have breast cancer?
Okay, so cancer in a bit in Ghana here. Up before then, now we have a lot of education going on
Yeah.
about cancer. At first, when you have cancer, people think we have
You are dead.
deaths.
Yeah.
Oh, okay.
So the person is emotionally traumatized.
Yeah.
If you have worked with people with cancer, you know that it's like they feel they are going to die. So they don't even want people to know. And environment. If someone is having a terminal condition, or
The way
say
you start to
if you
treat,
Yeah.
So all these things are part.
Yeah.
Then also with the surgery bit that we are talking about, surgery is not a cure for breast cancer.
Yeah.
So that everyone knows. So as I said, the cancer can spread to every part of their body. So before you go and do, let's say, a mastectomy for someone, we have to stage the cancer. If the cancer has spread to your liver, to your kidney, or to your bones, or even your brain, if you do the surgery for you, what of the mets in your liver? What of the ones in your bones? Are you going to take care of that one too? So surgery helps, but depending on the stage. If it's a localized tumor, we will do the surgery, then we will follow with either radiotherapy or chemotherapy. I know some of us, we've heard of chemo. So that's using medications. So even the treatment, we have two forms. So we have the palliative and we have the curative.
We have a lot of things to learn.
So if you are, if your cancer is, let's say, stage 4, you get to a point, we tell her, okay, we cannot cure you. We can't make you cancer free, but we can extend your time. We can reduce the symptoms you're having. That one we say we are doing palliative chemotherapy for this person. If your cancer can be cured, you say, okay, we are looking towards making you cancer free. So we are looking at treatment.
Okay.
So that's one thing that we should also take note of. Yeah.
Okay. And there has been, should I call it myths or like stuff? Like people come and be like, if your boobs get sagged or something, it can prevent you from getting breast cancer. If you see a lot of people saying it online, that we should allow, you've not seen it, that we should allow the guys suck our boobs and things. Yeah.
Okay.
Because, something like that. So how
does it help? Someone sucking your boobs off.
So breastfeeding and sucking of breast, they are two different things. Right?
Okay.
Sucking of breast by adults will
I
not
like what you said
prevent
by adults.
will not prevent breast cancer.
Okay.
But breastfeeding, so a breastfeeding mother, if you are breastfeeding, it reduces your risk.
Oh, okay.
The reason is that the progress is controlled by hormones in the body. When a woman gives birth, there are certain hormones which are shut down and others which are elevated. So if you are breastfeeding, you have a hormone known as prolactin that's released that makes you breastfeed or produce breast milk. So your estrogen and progesterone levels go down. And those hormones feed the cancer. So if you have low levels of estrogens and low levels of progesterone over a period, your risk is low. But for an adult or a male, sucking a woman's breast will not prevent.
Okay.
The whole idea about this was to encourage breast examination or breast examination.
Yeah, I mean, if somebody's sucking your breast and there's a
person
lump
feel,
filled,
the person will be like, what's that?
Yeah, but it
imagine
will not
that's how you
prevent.
find out you have cancer.
Oh, it's
No,
true.
that'd be
But like, I mean, yeah.
How did you find out you have cancer? I was making out.
Definitely, I think the boyfriends and girlfriends, they can help to like, you know.
No, even with that will not even let you know that you have cancer. It will just let you know that, okay, there's something wrong with the breast
going
that
on.
needs proper check. So we always advise women after your menstrual cycle, so after your menses, you have a week after your menstrual period, you have to check your breast. So mostly if you are under 30 years, that's what we always advise you, because during ovulation, the breast structure and everything changes. If you are menstruating, you know that the breast become tender and all those stuff. So we always advise a week after your menstrual period, you can now examine your breast. So the sucking bit that you're talking about, sucking will not prevent breast cancer.
Oh, that's sad.
Is it?
Yeah.
Okay, so with the examination you're talking about, can you demonstrate how we can self-examine
Okay.
the boobs
Okay.
for the audience that...
So to the ladies in the WhatsApp group and everyone out there. So if you want to examine your breast as a woman, you can do it in 2 ways.
Okay.
You can either lie down or you can stand in front of a mirror. When you stand in front of a mirror, you lift your hands this way. When you do this, you can now see what's going on here from the mirror. If you are going to, let's say, examine your left breast, you have to put your hand behind your head
So
like
it has
this.
to go behind.
Yeah, because I thought it was like
Yeah,
up.
no, actually,
So-
I thought it was
so-
this way.
so
And then
one is-
somebody
That's what I'm
said it
saying.
was
So one is
90
like this,
degrees.
and one is like this.
Ah.
But the only thing is you have to make sure that this side you have a proper view of this
Okay,
area.
okay.
Then you use 3 of
Four
these
fingers.
fingers. You place them here. Then you start from the top. Then you examine. If you are, let's say, a novice or someone who is starting,
Yeah.
we advise you to have an imaginary division. You divide your breast into 4. Then you start from each quadrant. Then you work to the
Around.
nipple. Now, when you get to the nipple, we advise people that okay, at that area you have to apply a bit of pressure, so that you can know if there's something going on there. So that's how we examine the breast.
Oh, that's it.
Yeah.
Now go pretend you.
I don't know, like
I mean, yeah.
because then me I be doing the most.
So that's with the touching.
What have you
bit.
been doing?
Then, oh no.
You won't
then,
even find what you're looking for.
then the other thing is that when you stand in front of a mirror, you have to also look at your breast. You know how your breast look like.
Looks like, yeah.
So look at the contour, the color, the texture. You know, okay, my breast, maybe the left breast has changed in color. We have something called poodle ranch. It can change into like an orange form, like the color changes, or the size of one change from the other. So we have to take note of all these things.
Okay.
Yeah.
But you normally part of our body, one is
Yeah,
also
one
a
is
bit
always bigger than the other one.
No, but it's not. It's not that. It's not
It's not- yeah,
significant.
it's not that,
Yeah.
okay.
So if you see that,
When it's obvious, you know that.
When it's
Mhm.
obvious. Okay.
what about Is it like generic?
Genetic.
Genetic. Sorry.
Okay. So we have risk factors that predisposes one to breast cancer. And it's good that you've brought it up. So we have what we call modifiable risk factors and non-modifiable risk factors. So as of now, nobody knows the exact cause of breast cancer. So I can't sit here and tell you, okay, it's only this that will cause breast cancer. But we have things or certain factors that predisposes an individual to breast cancer. Now, with the non-modifiable risk factors, it means there's nothing that you can do about it. And the first one is family history. So if you have, let's say, a mom who had breast cancer, or you have a first-degree relative, a sister, who had breast cancer, and you're a lady, your risk of having breast cancer is high. It doesn't mean that you have it, but your risk is high. The reason is simple. We have certain genes in the body. One is called the BRCA1 and the BRCA2. So these genes help control cell growth. Now, if there's mutations in those genes, it's like you are on the road and there's no police there. Every car will just overspeed.
Yeah.
So if the BRCA1 and BRCA2 are mutated, let's say, in your mom, and your mom gave birth to you, genetics is passed down. So the genes of your mom is transferred to you, the daughter. So it means you have that mutation in you. So in that state, it means your risk of developing breast cancer is high. So such a person, we always advise you, if you know that you have someone or you have a mom or sister who has breast cancer, you have to be checking your breast as often than the normal person. Then the other thing that you have to know about is age. So from the age of 40, 50, breast cancer can happen to any woman.
Yeah.
But as you are aging, your risk also increases. Then one thing is women who have early menstruation. So assuming you menstruated at the age of 12 years and you have late menopause, so like you by 60 years you had a menopause, your risk is higher. The reason is that during that period, the menstrual period or the reproductive periods, your hormones are elevated. Let's not forget I talked about estrogen and progesterone. So those are the ones that control the menstrual cycle. So during those instances, it means you have been exposed to the hormones for a very long time. And with that, your risk
It's high.
also increases. Then one thing is about race. So research have shown that most of the black women, when they get breast cancer, is aggressive than the Caucasians.
Oh wow.
Yeah. The breast cancer out there is, the number is huge than in Africa. But with black American or black race, when you get breast cancer, you mostly get the aggressive form.
Wow.
Yeah.
When you say the aggressive form, like what does it mean?
So when you get it, it spreads very fast.
Oh, okay.
So your risk of metastasis is very, very huge.
Do you
Metastasis
think
means
it's
that
because we
It's going
don't
to
we
other
don't
organs.
notice it on time?
oh no, I think it has to do with our genes. And with ours too, one disadvantage is our systems here is not like outside. Here, how many women do check their breasts in a year?
Yeah,
Yeah,
that's what I
yeah.
was.
So some people it's maybe out of a routine check, accidentally.
At work and
Yeah.
things.
Yes.
Yeah.
Because I know someone who had breast cancer and she didn't even know. She reported to the hospital. They're running routine labs and they got to know that.
She actually has
Yes.
breast cancer.
And she was even in disagreement. She didn't believe until got to a point. Yeah, there are people like that.
Mm-hmm.
So that's one thing. And because the test, like biopsy, is very expensive. Other screens are very
Yeah, I was going
expensive.
to
Yeah.
I was going to ask a question. So I know that you can get treatment for breast cancer at Kwadwo. Are there any other hospitals that you
Oh,
can?
fortunately, now we have a couple of hospitals that are on board now who are also doing chemotherapy, who are doing breast cancer treatment in Ghana here. But the amount involved,
Mhm.
somewhere like Kolebu, somewhere like Konfanoche, they have the NHIs working there. If it's a private facility, you won't get most of these services. And the medications are expensive. That's why we always say that early detection is very key. Because if you're able to detect it early, that one,
You might not need all that.
yes.
Yeah.
But if you don't detect early, it becomes so serious.
Okay,
Yeah.
so how often? Because people do wait to October to go and screen. You know, when they see people doing free screening things. So how often do we screen or test for?
So as a woman, as I was saying, if you're in your reproductive age, like from 30 years and below, after every month, you can do your
Self-examination. Okay.
Then with people with risk, like if you have a family relative who had breast cancer, someone like you, we advise you that we have a test known as mammogram. So you go and do, it's like a photo.
Yeah.
They will check your breast. But even with that, I was talking about the risk factors. One of the risk factors is dense breast tissues.
Yeah.
So if you're a woman, you have very huge breasts.
Hey.
Oh, really?
It's also
Huh.
A factor.
increases your risk
Oh,
of breast cancer.
Damn.
The reason is that
know
if you have dense breast tissues
More
And-
surface area.
and the mammograph is being done or the mammogram is done, the scan might not pick the lumps or any abnormality. It will pick mostly the
The
tissues,
actual breast.
the fat
Wow.
tissues there.
Yeah.
So by the time maybe we realize that you have breast cancer, it had
it's grown.
yes. That's
Phew.
one of the problems.
But I have a question though. What about do like lifestyle affect
does your
like your
lifestyle-
chances, your lifestyle, like maybe you
Yeah,
people who
things you
drink,
eat, what
yeah,
you
things
do
you
and
eat,
stuff.
stuff
Yeah.
like that.
Those are called the non-modifiable risk factors.
Okay.
So those are called the modifiable
modifiable.
risk
Okay,
factors. So
yeah.
those things you can do something about. The first one is smoking.
Mm-hmm.
So to the ladies who have been consuming a lot of now they call it shisha, right? What they
Oh,
say is flex.
wow.
If you consume a lot of those stuff, you increase your risk because there are inflammatory mediators that are released. A lot of chemicals are going into your body.
Yeah.
And if that happens to you, your immune system
It's weak.
is getting compromised.
Yeah.
That's one. Another one is alcohol.
Hey.
Alcohol consumption. So if you are a woman who is alcoholic, your risk of having breast cancer is just around the corner. Then also we have what we call the sedentary lifestyle. So we have people maybe from here, they'll sit in their conditioned car, get to the house, sleep. They don't engage in any physical activity.
Okay.
They don't do anything that helps boost their immune system.
Hey.
It
You're
also-
calling me out too.
Oh,
It's like
sorry for lift.
so we need to exercise.
Yeah, it's good. It's
Yeah.
good.
Okay. So, what are some of the foods that we can eat to boost our immune system?
So we always advise that you take in a lot of vegetables, a lot of fruits, because those agents, they contains a lot of antioxidants. So antioxidants, they mop up radicals from the body. And when you do that, your immune system is primed up. So those are some of the modifiable risk factors. And we have this thing. If you've been exposed to radiation therapy before, let's say you're a child, you had maybe a childhood cancer, you've been treated with radiations, you are at risk of having breast cancer because the radiations does things to your cells. Yeah, that's one thing. Then also we have this thing, hormone replacement therapy. So they are like contraceptives. So there are women who have gotten to, let's say, menopause, but they do not want to have the symptoms of menopause. So the hot flashes and all those things. So they begin to take certain medications which are artificial hormones into the body. When you do that, you're also increasing your risk. And there is some research that shows that even women who take in oral contraceptives,
I was about to say,
I was going to ask.
if you take that one too, it increases your risk. But the issue is that when you stop it, they say the risk also reduces.
Okay.
So something like the emergency contraceptives. So we don't advise people to be abusing those agents because it can also predispose you to
What about
breast
the
cancer.
like the contraceptives that you take daily, not like the emergency ones, like the ones where like the birth control.
The
that's
birth
what-
control.
So that's why I say they are
That's
all part
the-
of the contraceptives.
Okay.
So the daily ones, their doses are lesser than the emergency. So if you are taking a daily for, let's say, 5 months, 1 year, someone takes it in that way. If you take it for a very long time, it predisposes you. But when you stop, your risk comes down. But the whole idea is that we don't advise that you abuse
Abuse.
contraceptives.
What about my PCOS women?
Yeah.
Are they also
So PCOS, the regimen that you will be on will be determined by your doctor, and you do those risk assessments before you are started on those.
But if
therapies.
someone has PCOS, are they more like
Prone to
susceptible?
get-
Are they more
yeah.
prone to having
Breast cancer.
breast
Okay,
cancer
so
than like
with PCOS, there has me a direct link of PCOS
to
to
breast cancer.
Okay.
breast cancer.
Okay.
Okay.
Yeah.
Okay, so people people do advertise about herbal medicines for cancer in general. Do they work?
So I can speak for my side.
Okay.
From the expertise I have and what I do, because I work with cancer patients almost every day.
Okay.
And what I've seen, I'll give an example. We had people who had cancer, right? And the person went to do their own something somewhere.
Yeah, concussion.
Yes. When the person came, the cancer had spread.
oh God.
So we always tell people that if you are diagnosed, you don't have time. Cancer doesn't wait for you.
Yeah.
As you are sitting there wallowing, trying to find other alternatives, the cancer is spreading.
It's spreading. Yeah.
And when it starts to spread like that, you can't stop it.
Yeah.
So with the herbal bit, from where I'm sitting, I can't say that it works because from what I've seen, there's no proven evidence because we work with evidence. It's evidence-based therapy that we do.
Yeah.
So I won't sit here and tell her if you have breast cancer, I'll direct you to herbal. No, I won't do that.
Okay.
Yeah.
Okay.
All
I have a
right.
question.
All
Sorry.
right.
What's the death rate for breast cancer? Like, do a lot of people pass away from breast cancer?
A lot.
A lot.
A lot.
That's crazy.
Heaven
Especially
company.
people who were diagnosed very late,
Yeah.
people who refused treatment, people who had fears with treatment, people who couldn't afford treatment.
Afford treatments.
They
Yeah.
pass on.
Wow.
And
that's crazy.
sometimes it's sad to come to the hospital and we tell you that, okay, woman, where your cancer has gotten to, there's nothing we can do. Even though we have medications for this type of
It won't-
breast cancer,
yeah.
It won't
but
work.
where your cancer has gotten to, the medications might even kill you faster because your state that you are in. We have something we call performance status. So we do that to know, okay, this person can receive chemo, this person can do this, but we know, okay, with yours, we can't
There's
do
nothing
anything.
we
There's
can
And you might
nothing.
have, like, let's say, 2 months to live or
Oh.
less.
That's
And sometimes
crazy.
you be there, you tell the family, and some people, they have money, but they made a late decision.
Yeah.
They didn't even adhere to the
Yeah, see, that's what I was asking
treatment.
if the reason why in Black people, like, it's aggressive, because I feel like
They
most-
don't detect it early.
Yeah, most of us we don't the way we're brought up, we don't
Yeah, the
go
way
to the
we're-
hospital
yeah,
every
yeah.
time. We don't. It's not something that you check.
So I always tell people that don't pride yourself if you say, "Oh, for 10 years I've not been to hospital." Like it's something that
Yeah, you know, it's such a Ghanaian thing to say.
Yeah.
Actually, oh,
I
like
said something
I've
this morning.
not-
I was telling my sister, it's been so long since I felt sick. I'm so strong. It's a
So
lie.
you don't always have to be sick before you go to the hospital.
Mhm. Sometimes you need to
do a
check.
routine
We always
checkup.
say
Yeah.
prevention is better than cure.
Yeah.
If we detect it very early, we can arrest it. We
Mhm.
can manage it. We have people who have been cancer free for like 15 years, 20 years, and they are good. If they don't tell you they have cancer,
You're not
you
gonna
will never
You
know.
Okay.
true.
All right. So I want to know, you said from 30 below, right? Is it possible that children actually do get breast cancer? Like
Breast
Kids.
cancer in kids has not been proven. So I always say that mostly from when you start your menstrual cycle,
okay.
that's when your risk begins.
Okay.
Because that's when your hormones
Okay.
start to come into your system at a large quantity.
Okay.
Yeah.
Okay, I have a follow-up question for
Okay.
that. So you said when you start your menstrual cycle, does that mean that people that have irregular cycles, are they more prone to breast cancer?
So far as you are menstruating, if it's regular, irregular, you are still menstruating.
Yeah.
So you are
You are prone
Prone,
automatically.
No, I wanted to know if you have a higher
Higher
risk.
chance.
Oh,
Yeah, because
okay.
you see, there are people that their cycles are very irregular. You can
Mhm.
get your
I think
period
those
2
are the
times in a
PCOS
month.
people,
Yeah.
yeah.
So
Yeah.
I'm just okay.
All right. Do we have any more questions so that we wrap up? Ginger.
No.
Are you okay?
I don't think I have any more questions.
Okay. So, ladies and gentlemen, this has been an educative session. If you guys have questions, you can put it in the comment section, and probably maybe Doc will come again another time and be able to answer that. But let us know what you think in the comment section. Don't forget to like, comment, and subscribe.
Please come to TLH.
Yes, come
Please,
for
TLH 24, 26th October, Marina Mall. We do free breast screening, health talks. We're doing sales. You can come and buy skincare, makeup, everything.
I'm gonna be there too.
Yeah, Ginger is going to check her breast this year. I'll make sure.
I did
That you
last year,
check-
but I'm ready to check again.
All right, guys. So if you want free screening,
Yeah.
as she said, 26th at Marina Mall, go get your breast screened and know if you have breast cancer or not. So we out.